In July last year, I declared a public health emergency of international concern over the multi-country outbreak of Mpox, and the virus spread rapidly across the world. In total, more than 87,000 cases and 140 deaths have been reported to WHO from 111 countries. WHO has been very encouraged by the rapid response of countries. We now see steady progress in controlling the outbreak based on the lessons of HIV and working closely with the most affected communities. Almost 90% fewer cases were reported in the past 3 months compared with the previous 3 months. Yesterday, the Emergency Committee for Mpox met and recommended to me that the multi-country outbreak of Mpox no longer represents a public health emergency of international concern. I have accepted that advice, and I'm pleased to declare that the Mpox is no longer a global health emergency. However, as with COVID-19, that does not mean that the work is over. Mpox continues to pose significant public health challenges that need a robust, proactive, and sustainable response. Integration of Mpox prevention and care into existing health programs is recommended to allow continued access to care and rapid response to address future outbreaks. WHO will continue to work toward supporting access to countermeasures as more information on effectiveness of interventions becomes available. While the emergencies of Mpox and COVID-19 are both over, the threat of resurgent waves remains for both. Both viruses continue to circulate and both continue to kill.
So the committee recognises this need for ongoing commitments to maintain the plans to control Mpox, with a long-term goal that the human-to-human transmission will be eliminated, as well as mitigation of zoonotic transmission where possible. And that transition requires many integrated activities, which include integrating Mpox prevention, preparedness and response within national surveillance and control programs, including those for HIV and other sexually transmitted infections.
It is absolutely critically important that we continue the efforts that have been initiated already, because as we are all aware through the past few years, that as long as a virus is given an opportunity to continue to transmit from person to person, it also has the opportunity to change, to mutate, to evolve. And this is particularly true in the instance when people who are immunocompromised are affected.
It is a neglected disease, and it's been totally neglected during this outbreak. In fact, WHO had to fund all of this international response purely on the basis of a contingency fund. It's not that will it become a neglected disease? It was a neglected disease, it is a neglected disease, and it will continue to be a neglected disease, and it may come back, and it may shock us in future. We need to keep monitoring this virus. We're dealing currently with 56 graded health emergencies around the world. Of those, 14 are grade 3, which is our highest grade of emergency. We've over 24 outbreaks of cholera going on in many countries, particularly in Africa. I think anyone who works right now on immunization will see the huge increase in measles outbreaks we're seeing around the world. So the world is not quiet from the point of view of infectious diseases nor other health emergencies.
Ongoing fighting in Khartoum and across Sudan continues to cost lives and cripple the country economically and socially. As well as facing shelling and insecurity, people are dealing with dwindling supplies of water, food, medicines, and electricity. 70% of health facilities in areas affected by fighting are out of service. And WHO has verified 30 attacks on health. Outbreaks of malaria, dengue, and measles have been reported, and millions of children and pregnant and breastfeeding women are estimated to be acutely malnourished. I thank the governments of Chad, Egypt, Ethiopia, and South Sudan for welcoming refugees from Sudan. WHO is supporting these countries to provide health services to people who have had to leave their homes. We have managed to deliver a significant quantity of supplies to Port Sudan, but unless these supplies can be distributed to health facilities, they are of no use. Establishing safe routes for humanitarian aid is critical, but the ultimate solution is peace.